Good morning, friends. I'm Arthur, and welcome back to Senior Strength Show. Now, before we dive into today's life or death revelation, if you're 60, 70, or 80 years old and you've been ignoring what's happening to your feet, hit that subscribe button right now, because what I'm about to reveal could literally save your life. Today, I'm joined by Dr. Patricia Wilson, a vascular specialist who spent 30 years studying how circulation problems in seniors' feet predict and cause death. Doctor, you've made a shocking statement that death literally begins at our feet. What do you mean by this?
Thank you for having me address this critical issue. What most people don't realize is that your feet are like the canary in the coal mine for your entire circulatory system. When circulation to your feet begins to fail, it's a warning sign that death is approaching, often within months or years.
Doctor, that sounds absolutely terrifying. Are you saying that problems with our feet can predict when we're going to die?
That's exactly what the research shows. Poor circulation to the extremities is one of the most accurate predictors of mortality in seniors. But here's what's shocking. There's one specific food that can reverse this death process and restore life-saving circulation to your feet within weeks.
A food that can literally reverse the death process? Doctor, that sounds almost impossible to believe.
I understand the skepticism, but the science is clear. This food contains compounds that can reopen blocked blood vessels, restore circulation, and literally pull seniors back from the brink of death. But before I reveal it, people need to understand why their feet hold the key to their survival.
Doctor, explain how problems in our feet can lead to death.
Your feet are the farthest point from your heart, which means they're the first place where circulation problems become apparent. When blood flow to your feet decreases, it indicates that your entire cardiovascular system is failing. Poor foot circulation is a warning sign that blood flow to your brain, heart, and kidneys is also compromised. Studies show that seniors with circulation problems in their feet have a 70% higher risk of heart attack and stroke within 5 years.
What are the warning signs that death is beginning in someone's feet?
Cold feet that never warm up, numbness or tingling, slow healing cuts or sores, changes in skin color, and loss of hair on the feet and legs. These are all signs that circulation is failing and death is approaching.
How quickly can this circulation failure lead to serious complications?
Once circulation problems begin, the progression can be rapid. Minor cuts can become infected and lead to gangrene within weeks. Blood clots can form and travel to the heart or brain, causing fatal heart attacks or strokes.
Doctor, what makes seniors particularly vulnerable to this feet-to-death progression?
After age 60, blood vessels naturally stiffen and narrow. Diabetes, high blood pressure, and inflammation accelerate this process. Without intervention, the circulation death spiral becomes irreversible.
You mentioned there's a specific food that can reverse this process. Before you reveal it, how does poor circulation actually cause death?
Poor circulation starves your organs of oxygen and nutrients while allowing toxins to accumulate. Your heart works harder trying to pump blood through narrowed vessels, eventually leading to heart failure. Clots form in areas of poor circulation and can cause fatal strokes or pulmonary embolisms.
So the feet are literally a window into how close someone is to death.
Exactly. I can often predict a patient's 5-year survival odds just by examining their feet and testing their circulation. But here's the hopeful part. This life-saving food can reverse even advanced circulation problems.
Doctor, what specific signs should seniors look for to know if death is beginning in their feet?
The first and most dangerous sign is the cold foot test. If you touch your feet and they're consistently cold to the touch, even in warm environments, your circulation is already compromised and death is beginning. Another critical sign is the capillary refill test. Press on your toenail until it turns white, then release. If it takes more than 3 seconds to return to pink, your circulation is dangerously poor.
What about pain? Is foot pain a warning sign?
Paradoxically, lack of pain can be more dangerous than pain. Numbness means nerves are dying from lack of blood flow, but cramping pain, especially at night or when walking, indicates severely compromised circulation.
What about visual signs people can check for?
Yes, pale, blue, or mottled skin color indicates oxygen starvation. Thick, yellow toenails suggest fungal infections that thrive in poorly circulated tissue. Loss of hair on feet and legs means follicles are dying from lack of blood flow.
Doctor, how quickly should someone seek help if they notice these signs?
Immediately. These are medical emergencies disguised as minor foot problems. I've seen seniors develop life-threatening complications within days of noticing these warning signs.
What happens if these warning signs are ignored?
The progression is predictable and tragic. Minor wounds become infected, infections spread to bone, gangrene develops, and amputation becomes necessary. Each stage brings the person closer to death.
Doctor, before you reveal this life-saving food, I have to ask, how common are these circulation problems in seniors?
Over 60% of people over 70 have some degree of circulation impairment in their feet. Most don't realize how dangerous this is until it's almost too late. But the food I'm about to reveal can save their lives.
Doctor, please tell us what this miraculous food is that can reverse the death process.
The food is raw garlic, specifically 1 crushed clove of fresh garlic eaten daily on an empty stomach. But it must be prepared and consumed in a very specific way to activate its life-saving compounds. Garlic contains allicin, a powerful compound that opens blood vessels, prevents clots, and literally restores circulation to dying tissue. But most people consume garlic incorrectly and get no benefit.
Raw garlic? Doctor, that sounds so simple. How can something so common be so powerful?
Garlic has been called nature's medicine for thousands of years. Modern science has proven that allicin can increase blood flow by up to 40% within hours of consumption. For seniors with circulation problems, this can be the difference between life and death.
How exactly should seniors prepare and eat this garlic?
Crush 1 fresh clove of garlic and let it sit for 10 minutes to activate the allicin. Then, eat it raw on an empty stomach, followed by a glass of warm water. Never cook it or take garlic pills. They don't contain active allicin.
Why must it be raw and crushed?
Crushing breaks the cell walls and activates the enzyme that creates allicin. Cooking destroys this enzyme completely. Garlic pills are processed and contain no active compounds. Only fresh, crushed, raw garlic contains the life-saving allicin.
Doctor, what can seniors expect when they start eating raw garlic daily?
Within 24 to 48 hours, most people notice their feet feeling warmer. Within a week, numbness often begins to improve. Within a month, circulation tests show dramatic improvements that can literally add years to their lives.
Are there any seniors who shouldn't eat raw garlic?
People on blood thinners should consult their doctor first, as garlic enhances the effects of these medications. But for most seniors, raw garlic is safer and more effective than any prescription medication for circulation.
Doctor, explain the science behind how garlic can literally reverse the death process.
Allicin works through multiple mechanisms simultaneously. It relaxes blood vessel walls, allowing them to open wider. It prevents platelets from clumping together and forming deadly clots. It reduces inflammation that damages blood vessel linings. Most importantly, allicin stimulates the production of nitric oxide, which is your body's natural blood vessel dilator. This literally opens new pathways for blood to reach dying tissue.
How quickly does this process work?
The effects begin within minutes of consumption. Allicin enters the bloodstream rapidly and starts working immediately to improve circulation. But the full life-saving benefits develop over weeks and months of consistent use.
Doctor, what about people whose circulation is already severely compromised?
Even in advanced cases, I've seen remarkable recoveries. Seniors who were facing amputation have saved their limbs and their lives with daily raw garlic consumption. The key is starting immediately and being consistent.
Are there any other benefits beyond improved circulation?
Absolutely. Raw garlic lowers blood pressure, reduces cholesterol, boosts immune function, and has powerful anti-cancer properties. It's like a complete cardiovascular protection system in one small clove.
What makes garlic more effective than prescription medications?
Prescription blood thinners only prevent clots, but don't improve circulation. Garlic does both, while also reducing inflammation and supporting overall cardiovascular health. Plus, it has no dangerous side effects when used properly.
Doctor, you mentioned that timing and preparation are crucial. What happens if people do it wrong?
If garlic isn't crushed and allowed to activate, or if it's cooked, the allicin is destroyed and you get no benefit. Taking garlic pills or powder is essentially useless for circulation problems.
Doctor, can you share specific examples of seniors whose lives were saved by raw garlic?
I have dozens of dramatic cases. Robert, 78, came to me with severe circulation problems and was scheduled for leg amputation within a month. After 6 weeks of daily raw garlic, his circulation improved so dramatically that surgery was canceled. Margaret, 82, had feet so cold and numb that she couldn't feel injuries. She was developing infections and heading toward gangrene. 3 months of raw garlic restored sensation and circulation completely.
These sound like miraculous recoveries.
When you give the body the right tools, healing can seem miraculous. Frank, 75, had been told by 3 doctors that nothing could be done for his circulation problems. Raw garlic proved them all wrong.
What's the most dramatic life-saving case you've witnessed?
Eleanor, 85, was literally dying from multiple circulation-related complications. Her family was preparing for the worst. After 8 weeks of raw garlic therapy, not only did she recover, but her circulation tests showed improvement to levels typical of someone 20 years younger.
How do these patients feel about discovering such a simple solution?
Most are amazed that something so simple and inexpensive could be more powerful than expensive medical treatments. Many wish they'd known about raw garlic decades earlier.
Doctor, what about people who say they can't tolerate the taste or smell of raw garlic?
I tell them that the choice is simple. Tolerate garlic for a few minutes or tolerate disability and death for years. Most find the motivation once they understand what's at stake.
Are there ways to make raw garlic more tolerable?
Chase it immediately with warm water and lemon, or eat it with a small piece of apple. But never cook it or mix it with other foods during consumption. This reduces its effectiveness.
Doctor, how should seniors start this garlic protocol safely?
Start with half a clove daily for the first 3 days to allow your system to adjust. Then increase to 1 full clove daily. Always eat it on an empty stomach first thing in the morning for maximum absorption. Crush the garlic and let it sit for exactly 10 minutes to fully activate the allicin. Set a timer. This timing is critical for maximum potency.
What should people expect during the first week?
Some may experience mild stomach upset or stronger body odor as the garlic works through their system. These effects typically diminish within a week as the body adjusts.
How quickly should seniors see improvements in their circulation?
Feet should feel noticeably warmer within 24 to 48 hours. Numbness and tingling often improve within the first week. Visible improvements in skin color and texture usually appear within 2 to 3 weeks.
What about people on medications?
Those on blood thinners, blood pressure medications, or diabetes drugs should monitor their levels closely, as garlic can enhance these medications' effects. Dosage adjustments may be needed as circulation improves.
Doctor, how long should seniors continue this garlic protocol?
For life, poor circulation in seniors is a chronic condition that requires ongoing management. Daily raw garlic provides continuous protection against the circulation death spiral.
What happens if someone stops taking raw garlic after their circulation improves?
Unfortunately, the benefits are not permanent. Circulation problems will return within weeks of stopping. Think of raw garlic as a daily life insurance policy for your cardiovascular system.
Doctor, are there warning signs that indicate someone needs immediate medical attention despite eating raw garlic?
Yes. If you develop sudden, severe pain in your feet or legs, if wounds appear infected with red streaking, or if you notice black or blue discoloration of toes, seek emergency care immediately. Also, sudden onset of severe shortness of breath, chest pain, or weakness on one side of the body could indicate that a clot has traveled to your lungs or brain. These are medical emergencies.
How can people tell if the garlic therapy is working?
The socks test is simple and effective. If you can wear socks comfortably and your feet stay warm, circulation is improving. If cuts and scrapes heal within normal timeframes, blood flow is adequate.
What about professional monitoring?
I recommend seniors have their circulation checked by a vascular specialist every 6 months, especially if they've had circulation problems. Simple tests can measure blood flow and detect improvements or deterioration.
Doctor, what other lifestyle factors support the garlic therapy?
Daily walking, even just 10 to 15 minutes, helps pump blood through the vessels that garlic has opened. Elevating feet when sitting, wearing loose-fitting shoes, and avoiding smoking all support improved circulation.
Are there foods that counteract garlic's benefits?
High sugar foods and processed foods create inflammation that works against garlic's benefits. Seniors should minimize these while following the garlic protocol for maximum effectiveness.
Doctor, let's give our viewers a complete protocol for using garlic to save their lives.
Here's the complete circulation Lifesaver protocol. Daily, 1 crushed clove of fresh garlic. Let's sit 10 minutes. Eat on empty stomach with warm water. Weekly, check feet for temperature, color changes, and healing of any cuts or scrapes. Monthly, perform the capillary refill test and monitor overall circulation improvements.
What about foot care while following this protocol?
Inspect feet daily for cuts, changes in color, or signs of infection. Keep feet clean and dry, wear properly fitting shoes, and never ignore even minor injuries.
How should seniors track their progress?
Keep a simple daily log, noting foot temperature, any numbness or tingling, and overall energy levels. Most people see steady improvements that motivate continued compliance.
Doctor, what's the most important thing for seniors to remember about this protocol?
Consistency saves lives. Missing days allows circulation problems to return. This isn't a temporary treatment. It's a lifetime commitment to preventing death from circulation failure.
What gives you the most confidence in recommending raw garlic?
30 years of clinical experience watching seniors transform from near death to vibrant health with this simple protocol. Raw garlic has saved more lives in my practice than any other intervention.
Doctor, what's your final message for seniors whose death may be beginning in their feet?
I want every senior to understand that circulation failure and death are not inevitable consequences of aging. Poor circulation is a medical condition that can be reversed with the right intervention. That one clove of raw garlic daily could be the difference between independence and disability, between life and death. The choice is literally in your hands every morning.
What hope do you have for seniors who start this protocol?
Tremendous hope. I've seen 90-year-olds regain circulation they lost decades earlier. The body's ability to heal is remarkable when given the right tools, and raw garlic is one of the most powerful tools available.
Before we go, folks, please hit that subscribe button and ring the notification bell. This information could literally save your life or the life of someone you love. Share this video with any senior who might be experiencing circulation problems. Doctor, thank you for revealing this life-saving protocol and giving seniors hope that death doesn't have to begin in their feet.
Thank you. Remember, everyone, every morning when you eat that clove of raw garlic, you're choosing life over death, circulation over stagnation, hope over despair. Your feet and your life depend on this choice.
Until next time, this is Senior Strength Show, where we're committed to helping you live, not just exist, at any age.